Sciatic neuropathy has a high prevalence in the general population. It commonly presents with pain, weakness, or sensation changes in the distribution of the sciatic nerve. Conservative treatment for 6 to 8 weeks is standard. When patients fail conservative management, lumbar imaging can be correlated with clinical findings, and up to 90% of sciatic symptoms are caused by nerve impingement of a herniated disc. In the minority of cases, less frequent causes can be explored, such as lumbar stenosis or tumors, with vascular etiology being the most uncommon cause of sciatic neuropathy. There are isolated reported cases of sciatic neuropathy due to vascular causes, and very few reports of venous malformations involving the sciatic nerve. Most cases described in literature were treated with surgery by ligation and stab avulsion phlebectomies of the varicostates associated with the nerve. Most of these patients having relief of symptoms or significant improvement. In our literature review, we found 3 patient cases reported of percutaneous sclerotherapy with reported good results at early follow-up. So we completed a retrospective review of 4 patients with sciatic neuropathy found to have a venous malformation diagnosed on ultrasound and MRI and were confirmed during intraprocedural venogram. So under moderate sedation, a 4 or 5 French catheter was advanced into the main draining veins of the gluteal venous malformations on the symptomatic side under fluoroscopy. Balloon occlusion venography was performed to confirm correct distribution and verify proximity or communication with the sciatic nerve. And then 3% STS was administered under roadmap guidance, followed by coil embolization of proximal venous tributaries. Follow-up was measured by patient reporting improvement of symptoms. So patient 1, a 38-year-old male, presented with chronic pain that radiated from the left gluteal cleft to the thigh with some minor calf and foot pain. He has a known congenital venous malformation and has had previous venous interventions at an outside hospital. On physical exam, there was significant atrophy of the left calf and thigh. So in these images, the white arrows are pointing to the abnormal veins in association with his sciatic nerve. So after STS administration, you can see the shrinking of the veins in proximity to the nerve that the white arrow is pointing to. So the patient's pain upon follow-up had significantly improved at 1 month and 3 months with some residual pain from a previous surgery. So patient 2 is a 44-year-old female with progressive right leg pain in the sciatic nerve distribution and vaginal pain for 1 to 2 years. She had right lower extremity varicosities on physical exam. So venogram is showing an oblique view of the pelvis showing inferior gluteal and sciatic varices down the right leg. Selective injections of the right inferior gluteal vein show varicosities consistent with the known venous malformation. The image on the right shows very subtle filling with contrast along the sciatic nerve, which the white arrow is pointing to. So at 1 month, her vaginal pain was reported 0 out of 10, and her right leg pain had largely improved. At 1 year, she had some residual right calf pain, and sonography revealed some residual varices in the thigh with no proximal source identified. The patient did not seek further treatment. So patient 3 was a 45-year-old female with left anterior and right posterior thigh pain that worsened throughout the day, especially when standing. She had previously received sclerotherapy at an outside hospital. So her images, venogram showed prominent posterior varicosities from the superior gluteal vein that communicated with the inferior gluteal vein in the vicinity of the sciatic nerve. So the native left and subtracted right DSA images during venography that you can see the subtle outline of the sciatic nerve that the white arrow is pointing to on the right, and the varicosities going down the leg along the sciatic nerve. And so here's native and subtractive DSA images again during venography, and you can see the outline of the sciatic nerve on the left that the white arrow is pointing to. So after 1 month, she reported her symptoms to have completely resolved, and at 1 year, some mild residual pain remaining in her sciatic nerve distribution, though she did not seek further treatment. So the last patient, patient 4, is a 72-year-old male presenting with progressive left lower extremity weakness and paresthesia over several years leading to falls. He had a complex medical history notable for a Klippel-Trenaunay syndrome and a congenital venous malformation. On physical exam, there is edema and dilated veins on the left leg. So on the left is an MRI sagittal image star sequence demonstrating increased signal in venous varicosities along the sciatic nerve that the white arrow is pointing to. Notice the intimate association of the varices with the sciatic nerve. And on the right is venography of the left thigh during sclerotherapy. The black arrow denotes the varicosities along the sciatic nerve. So he was followed over 3 years, and he had temporary success with mild improvement of symptoms and no progression. It's however likely that the patient had years of symptoms that were untreated. So results, symptoms were significantly improved or had completely resolved in all 4 patients at 3 months. At 1 year, 2 patients reported significant improvement, and 1 patient had a return of symptoms requiring retreatment, and 1 patient has not yet reached 1 year. So this can be considered in a small subset of patients that have varicosities in association with the sciatic nerve seen on imaging. Reported treatment of veins along the sciatic nerve has primarily been surgical, with only 3 patient cases involving percutaneous sclerotherapy. We've presented 4 patients treated with sclerotherapy in follow-up. Percutaneous sclerotherapy is a safe, minimally invasive option that offers an improvement in symptoms. This requires further investigation as a minimally invasive option for patients with sciatic neuropathy due to venous malformation.